Hi everyone, my name is Elisa Agostinetto. I'm a medical oncologist at the Institut Jules Bordet in Brussels, Belgium. And in this video, I will provide my highlights on breast cancer from ESMO 2025. This will be a short video of 2-3 minutes, so I will focus really on main highlights, and I've selected one highlight per breast cancer subtype. So starting from hormone receptor positive, HER2 negative breast cancer, here my highlight is that the data we saw actually confirm and support the use of adjuvant CDK4/6 inhibitors in the adjuvant setting, of course, for patients with high risk, hormone receptor positive, HER2 negative early breast cancer. At ESMO, we saw the primary overall survival results of monarchE, showing for the first time an overall survival benefit from adding CDK4/6 inhibitors, in this case abemaciclib, to adjuvant endocrine therapy. And we also saw the updated results of NATALEE that confirm a significant benefit from adding ribociclib to adjuvant endocrine therapy. In NATALEE, the overall survival data are still immature, but still, as of today, we have a confirmation with the follow-up that we have of a significant improvement in IDFS and distant relapse-free survival, including the population of patients with the node-negative disease, that is a subset of patients that was not included in the monarchE trial. Concerning HER2-positive breast cancer, well, here my main highlight would be that at ESMO 2025, we finally saw ADCs, and particularly trastuzumab deruxtecan, entering the treatment landscape for early HER2-positive breast cancer. We saw the results of two trials, Destiny Breast 05 and Destiny Breast 11, testing respectively the role of trastuzumab deruxtecan in the neoadjuvant setting and post-neoadjuvant setting. Finally, concerning triple-negative breast cancer, here I want to put the highlight on, again, ADCs, and particularly two ADCs that showed a significant survival improvement in first line for patients with triple-negative breast cancer, and specifically patients with a disease where immunotherapy is not an option, so either because it's a PD-L1 negative disease or patients ineligible to receive immunotherapy. So we saw the results of two trials, ASCENT-03 and TROPION Breast 02, that tested two different ADCs, sacituzumab govitecan in ASCENT-03 and datopotamab deruxtecan in TROPION Breast 02. Both trials showed this significant improvement in PFS. In TROPION Breast 02, we also had a significant improvement in overall survival because PFS OS was the dual primary endpoint, but there were some differences between these two trials. So, for instance, crossover was allowed for ASCENT-03 while it was not allowed for TROPION Breast 01, and there were also some differences in the type of patient population. So there are still, of course, many open questions, but still we are talking about very important results that will certainly change the way that we treat breast cancer in the next future.